This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're actually on the first floor right here in the pharmacy. We're going to be speaking with pharmacist Andrew Russell. He's going to tell us about the shingles virus and how a vaccination might be able to help prevent that painful rash. Well, thank you for taking some time with us today, and we're getting to know a little bit more about the shingles virus and then also what we can do about it. First of all, let's just talk a little bit about shingles. Some people may know about it, others may not. What is shingles?
Sure. So shingles is a viral infection caused by what's known as the varicella zoster virus, which is the same virus that causes the chicken pox. If you've had the chicken pox, it's a virus that will lay dormant in your body until it reestablishes itself as we age in the form of shingles. About 30% of people that have had the chicken pox will develop shingles at some point in their life.
So what are some of the symptoms involved with shingles?
So shingles typically develops as a rash that can form painful blisters. The blisters usually scab over after about 3 to 5 days. However, the rash can last for anywhere from 2 to 4 weeks. Sometimes pain from the rash or the infection can last anywhere from months to years following an infection.
All right, so if we have shingles, should we get to a doctor right away, or is that something that we can come see a pharmacist right away for?
I would certainly encourage you to see your primary care provider about that, yeah.
Okay, so what's available? What kind of remedy do we have if we develop shingles? There's a vaccination now, right?
Well, the vaccination is typically to prevent the shingles from occurring in the first place.
Oh, okay.
However, there is medication that a prescriber could prescribe for you if in the event that you do get shingles. Yeah.
Sure. Well, let's talk a little bit about prevention and that vaccination.
Certainly. The vaccine itself is called the Zostavax vaccine. It protects against the varicella zoster virus, like we alluded to earlier. It's a one-time vaccine for folks. It's typically given in the back of the upper arm.
Does that mean that if I get that shingles vaccination, does that mean I won't ever get shingles?
Unfortunately, the vaccine isn't 100% effective at completely avoiding the shingles. However, if you were to get shingles after getting the vaccine, the symptoms would typically be much milder than if you hadn't gotten the vaccine.
Okay, so shingles, is that something that we're looking at a younger age, or is that something that develops older, and when should we think about getting that vaccination?
Typically the vaccine is targeted at our older folks. The FDA recommends it for people, or it's FDA approved, I guess, for people over the age of 50. However, the CDC recommends that anyone over the age of 60 get the vaccine.
Okay, so if I've already had shingles, does the vaccination, would I still need a vaccination, or am I done with shingles?
Sure. No, even if you've already had shingles, you may still benefit from the vaccine. We typically recommend getting the vaccine about 6 to 12 months after the virus has taken its course and your symptoms improve.
All right. So relatively new vaccination then for shingles? Is this
It's been around for a little while. I can't tell you exactly when it was done.
Relatively safe, though?
Oh, absolutely.
Yeah. Okay. How about the costs involved in the vaccination?
Well, the vaccine is typically covered under most insurance plans. Any pharmacy caregiver at Aurora can help determine your insurance coverage if the vaccine will be covered for you. People can get in touch with their insurance company if they have questions about what their copay might be or if it is in fact covered. Medicare Part D patients do need to receive the vaccine at the pharmacy. It's not covered under Medicare Part B, so they can't receive the vaccine at the doctor's office.
Okay, so is it something that I need to get a prescription for, or can I just show up at the pharmacy and you give me the vaccination?
Sure. Typically, we would prefer that you get a prescription for the vaccine from your primary care provider. However, we do have a doctor that will write prescriptions for the Zostavax vaccine for you.
Okay, so how do we get vaccinated? Where are the pharmacies located now?
We have 4 convenient area locations, 2 of which are in Oshkosh. There's a pharmacy in the Aurora Medical Center in Oshkosh. There's one on Bowen Street in Oshkosh. We have a pharmacy in Fond du Lac on Wisconsin American Drive and in Watoma on Division Street. I'd encourage anybody that wants any more information about the vaccine to get in touch with their local Aurora pharmacy.
Mm-hmm. Do you find many people have a lot of questions or concerns when they're getting vaccinated?
Certainly. Any vaccine, anytime you're getting some kind of procedure done, there's certainly questions. Our pharmacists really do take the time to go through the vaccination with everybody. We go through a series of questions just to determine if someone's an eligible candidate for the vaccine. Some people might not be an eligible candidate for the vaccine due to certain medications they take or certain disease states they might have, but our Aurora pharmacists will determine that at the time of the vaccine.
How about side effects?
Not a lot of side effects to consider, and generally anything or any vaccine can have different side effects depending on the individual. However, the most common side effect is a small injection site reaction. That would be just some redness and some tenderness in the injection site. That can be taken care of with some ice and maybe some Benadryl.
If somebody has shingles, is it then contagious?
The shingles is contagious for a small amount of time while the rash is present. As soon as that rash crosses over, the shingles is not contagious. As a whole, too, shingles is a lot less contagious than the chickenpox, and somebody with shingles in the later stages would not be contagious.
A lot of great information today. We appreciate you joining us today.
Absolutely. Thank you for having me.
Unlike other vaccinations, this is one that you only need once in your life. Now, if you have any questions about shingles or the vaccination, you can always get a hold of your primary care provider or get a hold of one of the pharmacists here at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.